this is my friend. This is Austin Vick. He's a paramedic that I work with. We just kind of want to talk about, a lot of people, they get together, in couples, or they may get together in 3 or 4. A lot of people go hiking together. A lot of people go camping together. Canoeing, all different types of outdoor activities. Anyway, so in order to have this conversation about safety, I'm just going to ask questions, and Vic, he may ask me some questions. If we were hiking up a trail and either I or my friend, we started having chest pains or something like that, what are some of the signs of a heart attack?
There's differences between men and women. So mostly in men, you're going to see, just the chest pain. It could be a pressure, or it might even be a sharp pain. That pain can go up into your jaw or maybe to your left arm usually. And shortness of breath usually accompanies that. As opposed to women, it's not quite the normal, what would you say, chest pain or heart attack presentation. It's usually abdominal pain, maybe some nausea, or maybe some indigestion type feelings, and could even feel pain in their back.
So if my partner was experiencing that, or I was experiencing that, and let's say that he just got to the point where he just passed out, okay, and he was having a heart attack, I guess what I'm going to try to do is I'm going to, if I've got my cell phone with me, I know that a lot of people may not take them when they're hiking or camping, but if I did have my cell phone, I should immediately try to call 911, right?
Absolutely.
Okay. Yeah. And like you were saying, that I need to try to remember the closest point that is a major intersection, so that if I was able to get a hold of 911, then I could tell them, hey, I'm probably a mile, 2 miles from this last point right here, which if I could get to that point would be a place where they could actually meet, and we could meet up, okay? My partner, he has passed out. As far as a heart attack, what do I need to do in order to help save my partner?
Of course, you're going to want to get down next to them. You're going to want to check a pulse in their arm, in their neck, and listen and look to see if they're breathing. And if they're not, then you need to immediately start CPR.
Okay. Well, how do I check for a pulse in the neck?
It'd be the artery that's in the neck. You're going to take 2 fingers, never your thumb, because you can actually feel your own pulse in your thumb.
Okay, so I've checked for a pulse. I don't feel a pulse, and I don't see any chest rise and fall. Okay? What do I do at that point?
You need to immediately start CPR. Usually you'd lay one hand over the other, whichever way you feel comfortable, and interlock your fingers is how I do it. And you'd take the palm of your heel and you'd put it just over their sternum, and you would begin compressing. You'd want to keep your arms straight and locked and bend at the hip to push. And you want to push down about 2 inches. And you would do that at about 100 times per minute. The song that you could play in your head to try to keep that rhythm would be Staying Alive, as unfortunate as that timing may be for it. But you're going to do 30 compressions, and then you would do 2 breaths. If you don't have a mask, you would plug their nose and tilt their head to help open their airway.
Okay, so if what he's saying is you do 5 cycles of compressions and ventilation, so it's 30 and 2, and stop and check. If we do have a pulse, then what do we do?
Well, you're going to want to try to hang tight for a little bit, because the heart being just through that cardiac arrest, you don't want to get up and moving and trying to get out of there, because that strain could cause further damage or possibly another cardiac arrest. So you're going to want to try to stay where you are. If you can, go off and contact 911, try again. Further let them know that you've got them back, you've got a pulse. They might or might not be awake, and try to give them your location so that way rescue or EMS can get to you to transport them.
Okay. If we did 30 cycles and 2 ventilations 5 times and we still didn't have a pulse, then what do we do?
Well, you would start the process over again of immediately going back into compressions and 2 ventilations after 30 compressions.
Okay. So folks, what we're going to do in the event of a cardiac arrest, we're going to do 30 compressions, we're going to do 2 ventilations, we're going to do 5 sets of those. We're going to stop and check for a pulse. If we don't have a pulse, we're going to continue doing another 30 and 2 for another 5 sets. You're only one person, and you're only going to be able to do quality CPR. Like he said earlier, you're going to have to compress the chest at least 2 inches. And you may only last for 3, 4, maybe even 5 cycles, because we've done it before and it's tough. So in the event that you've done it that many times and you just give out and you can't do any more, you have tried, and if you still don't have a pulse, there's probably nothing that you're going to be able to do. But sometimes it does happen to where if a person experiences a cardiac event, the compressions will bring them back, and like he said, just kind of hang tight, wait for EMS or rescue or fire or whoever it is that's going to respond to you, the park service, you know, if you're up in the national park, to be able to carry them out and treat them like that they should be. A lot of times when you're out in the bush, I know that older people are most generally the ones that have a stroke, okay, but young people have them too. Okay, what are some of the signs if we're out, again, in the same scenario, we're out 3, 5 days, maybe some people even go 10 days at a time, especially those that hike the Appalachian Trail. What are some signs that a person may be experiencing a stroke?
I'm usually going to see, you know, one-sided weakness. You know, maybe they can't, it starts off, they can't feel, you know, maybe their left hand and their left foot, or, you know, maybe the left side of their face starts to droop a little bit. Or, you know, they could even be complaining of a headache, you know. They could start to speak and not make any sense, kind of just gibberish, or maybe they've lost their orientation. All of a sudden, to them, they don't know where they are.
What does the Cincinnati Stroke Scale do?
Well, it assesses the equalness between the 2 halves of the brain. So generally, you're going to have them close their eyes and put their arms straight out and see if maybe one arm drifts lower than the other. You can also ask them to squeeze your fingers and see if they both squeeze equally.
The other one is the smile. You check and see if, you ask them to smile for you if they got an equal smile. In other words, you want both sides up at the same time. You don't want one side up and the other side kind of hanging down. The other one is to check and see if they can actually speak, okay, with just something random, like you can't teach an old dog new tricks, okay. You know what their normal is. So if you ask them to say that and it's slurred, okay, chances are they could be experiencing a stroke then. So we're going to be talking about our safety series, and you know, everybody when they go out in the back country, whether they're hiking, camping, or whatever, if they're smart, they're going to take a first aid kit. A lot of hikers are probably not going to carry anything this heavy because they're concerned with the least amount of weight possible. But regardless of the type of first aid kit that you've got, you know, everybody knows that they should have one. But what do you do with it? So that's why we're here today. We're going to be talking about a few things that people may not have thought about as far as the first aid goes, and things that could happen out there, hiking, camping, canoeing, whatever it is that you may be doing outdoors. Accidents do happen, we know, because this is what we do, and we've seen it all pretty much. But anyway, so we're going to be talking about some different things today that could happen that you may not have thought about, that you should probably, you know, hopefully we can give you a little bit of basic information so that you can be ready for those events if they do happen. Let's say that we were out in the woods, and or we were on a trail somewhere and we actually broke an ankle, okay? I know that a lot of times we use a pillow to splint that, you know. You could use actually your bedroll, okay, your sleeping bag or something like that. You just wrap around it several times and then take some tape, or you could take rope, whatever, cordage, whatever it is that you have, and you just kind of fold it around and splint that in place. But let's say that I broke my lower leg right here, okay? There are 2 things that we're concerned with on broken bones. If you break something in between 2 joints, you splint from the joint farthest away to the joint farthest or closest to you. In other words, that being away, this being to the center of the body. So if we broke the lower portion of the leg, we want to splint from this joint to this joint right here to be able to support the bone pieces in between those two joints. If we actually break the leg here around the knee or something, we're going to splint from the bone below that to the bone above it. Okay. All right, so what he's going to show you is how to, if I've broken my leg between my knee and my ankle and you don't have anything else, he's going to show you how to just primarily take 2 sticks and splint the leg so that it will work.
Yep, and like you said, you go for the joint below and the joint above, and you can have him, or whoever it is that's been injured, you can have them help you. You want to go, obviously, above the injury. You don't want to go at the side of the injury. And that would simulate a makeshift splint that you could do out in the bush. Obviously, you'd want to tighten everything down a little bit more because you want this bone to move as little as possible to help reduce further injury.
Okay, let's say that I've broken a femur. Okay, what do I do then?
Well, then you would want to splint the joint below and above as the same you would any other long bone fracture. But the sizes of your sticks would change a little bit. A shorter one to go on the inside and a longer one to go on the outside.
Okay, primarily what we've done is we've tried to immobilize this femur right here. Okay, so we've done a femur, we've done a below the knee, a tib fib. What if I fell and broke my arm here? How do I splint that?
So you again would want to splint the joint below and the joint above. This wouldn't be a little bit harder just because they wouldn't be. And you would want to try to make sure it's not too tight where they can't feel their hand, but you would be able to feel a pulse and make sure they can still feel.
Anyway, so that's how you would splint an arm if you broke it from below the elbow. And the same thing is going to apply if you broke it up here. You just slide these up from joint to joint primarily, tie them off the same way. And since it's up here, you can bend the lower portion. You would probably want to tie your arm around here after this splint was on here so that your arm is not just dangling. And you can do the same thing with this as well. Just come across and tie down, and then you might want to tie one across through here, okay, so that you've got a two-way to keep that arm, and you can take the weight off. You don't actually have to hold it, and so that your arm would be stationary like this and not swinging around. So, well guys, we had to momentarily pull ourselves in because the sky got really black, and if you look, these trees are moving. They were probably bent over twice what you see them doing, and it sounded like that ridge way over there sounded like a train was coming through here just a while ago. Kind of got worried because didn't know, exactly what was happening. Was it a tornado? But I'll tell you, the trees were sure bent over up on that ridge. Now it seems like we just got some winds, some little bit of rain sideways. Hopefully it'll let up here in a little bit and we can get back to our safety review, but it came in no time at all. Hey guys, I know that you can probably hear that rain. I'm going to try to film a little bit. We had to really hurry and get out of that rain a while ago, and so we're cooking our dinner. We've got some vegetables, we're grilling some corn, we got some New York strip. But anyway, we'll have to finish this video another day, but we're still hungry, so wanted to kind of show you what we were having for dinner. Wanted to show you all what we came up with for dinner right here. New York strip, Brussels sprouts, onions, red peppers. Got a watermelon over there. Got some grilled corn over there. It's kind of getting cooled off a little bit because it was hot. But anyway, a really, really nice dinner. And sorry about, we're using the GoPro because I don't want to get the ADD out here and film in this rain. But anyway, yeah, we're going to sit down here and we're going to enjoy eating some of this strip and vegetables. Oh, oh man. Oh yeah. Yeah, baby. That's the bit I'm gonna have to watch out. I'm glad my shoes are tied to blow my shoes off. Oh, make your tongue slap your brains out, wouldn't it? That is good. Hey everyone, we hope that you enjoyed part 1. Stay tuned for part 2. If you liked it, give it a big thumbs up. We're so grateful if you like, share, and subscribe our videos. So everyone take care, and we hope to see you at the Outpost in the future.